Thank you for joining us. As you can see, I'm again working from home, just like many others, in this very perplexing time in history of worldwide pandemic and economic crisis. And as I said before, hardships like these often bring out the best in us. But what makes this more difficult is not knowing what to do and how we can all responsibly do our best for our loved ones and ourselves. As the weeks go by, new discoveries, theories and treatments are coming to light and being openly disseminated by scientists and medical professionals. These are also very well documented on a new website created by Bill Faloon, the co-founder of Life Extension, who will update us on the latest news following these messages.
Life Extension magazine brings you new discoveries in health and anti-aging. Our science-based research and supplements are so advanced they're many years ahead of the medical mainstream, with quality control standards that exceed FDA mandates. Life Extension has covered groundbreaking medical research for more than 35 years. For your health and future, you deserve the best. Learn more at lifeextension.com.
We know that we're asking Americans to do a lot right now. So we're asking everyone to be selfless for others so that we can protect those who are most susceptible to this virus.
A question I often get asked is, why should young people care about the spread of coronavirus? Well, we know that people with underlying medical conditions over the age of 60 are at highest risk, but they've got to get it from somebody.
Social distancing is really physical separation of people.
It's what we refer to when we ask people to stay at least 6 feet apart.
Not going to bars, not going to restaurants, not going to theaters where there are a lot of people. It all just means physical separation so that you have a space between you and others who might actually be infected or infect you.
We all have a role to play in preventing person-to-person spread of this disease, which can be deadly for vulnerable groups. For more information on how you can social distance, please go to coronavirus.gov.
Joining us now from South Florida is Bill Faloon, co-founder of Life Extension. Bill, this is a new experience.
Certainly is. We've got a disease out there that up until recently, very few people knew how to effectively treat, keep people off these mechanical ventilators that the hospitals were using in the beginning, in which most people were not surviving.
Please elaborate on that, because it is very confusing to viewers and people all over the country, maybe all over the world. At first, here in the United States, we were told, oh, don't worry about it, it's fine. Then we were told, don't worry about masks, masks are not necessary. Then we were told there is a dire need for ventilators. And then we learned that so many people don't survive, and those who do survive are impaired for life.
Well, if you watch the news media, it would appear that the only problem with COVID-19 disease was the shortage of mechanical ventilators. Then as they got into the clinical course of the disease, they found that most of the people put on ventilators who were in advanced stages, they were not surviving. They were coming off dead. So I was in a state of panic. In late February and early March, we have about 1 million people who reach out to our Life Extension group when they have a medical issue in which the conventional people are unable to address. And back in early March, I had no idea what to suggest to enable a hospitalized COVID-19 disease patient to reduce their risk of progressing into the stage of requiring mechanical ventilation.
You know, it is such a shocking situation. I've seen video and images of mass graves in New York and bodies being sadly shoved into unrefrigerated trucks. And the
crematories in New York are running 24 hours a day. They were certainly running 24 hours a day. Mass graves, refrigerated trucks. Again, a state of panic put me into overdrive mode. I spent every single night reviewing hundreds of scientific reports as to what a hospitalized COVID-19 disease patient might be able to do to reduce their risk of worsening to the point of requiring a ventilator to sustain their life. Because the people put on these ventilators, they were surviving for a couple of weeks and then coming off dead. or coming off with severe multi-organ damage that would impair them for life. So I worked around the clock with a number of other scientists, by the way, and we were able to identify some existing medications that were already in the hospital formularies that, if administered in time, may enable people with severe COVID disease to survive in the ICU without a ventilator and get out of the hospital sooner. And those medications I'll describe during this talk, and also give out a website where we talk about these drugs that we don't have no financial interest in, by the way, but our research identified that they could alleviate the comorbidities associated with severe COVID-19 disease.
And the website is Age Reversal COVID.
It's age dash and then reversal dash covid.net. It's almost impossible for people to hear that, but if you put it up on the screen, please, people will be able to see it. And what it is, it's an information disseminating website. It has articles from many, many different sources, but what they pretty much consistently reveal is you need to control the pro-inflammatory cytokine storm that occurs in response to the COVID virus. You need to keep your immune system from overreacting. And in the process of overreacting, it's destroying, of course, lungs, kidneys, hearts, brain, intestines. It's doing horrific systemic damage. You need to turn that down. Now, a couple of years ago, there'd be nothing available to do that in a methodical way, but there is a drug out there. It's right now pretty much sold out because some of the doctors have figured out how to use it, called Actemra. That's the brand name of it. And what it does is it reduces interleukin-6 signaling. Interleukin-6 is a pro-inflammatory cytokine. And in response to COVID-19 disease infection, well, you wind up with the IL-6 levels that go up way too high. And that inflicts too much inflammatory damage. So we initially recommended people consider, always asking your doctor, of course, should I be on this Actemra drug if my IL-6 blood levels are over 80 to 100 on the typical scale. And some progressive doctors started using it. Fantastic news is it appears to be working at this stage. At this stage, the people who are involved in severe COVID disease, their inflammatory markers are through the roof. They get on the Actemra drug, which has to be administered in the hospital by a doctor. They are seeing the inflammatory markers go down, and then that relieves some of the comorbidities, the side effects that occur in addition to the viral damage. So that's one drug, and I'll talk about some more during this program.
Bill, many people strongly believe this is a time in history in which there should be absolute cooperation with no political bickering that hinders progress. Some treatments are evolving and changing, and it reminds me that in April, State Representative Karen Whitsett, a Democrat, thanked Republican President Trump for saving her life by enabling her to receive hydroxychloroquine to treat the coronavirus. My point is we need more open-mindedness and honesty and cooperation, not obstructive politicizing. What are your thoughts on this?
We don't get into the politics, we get into the scientific realities, and hydroxychloroquine plus zinc might have helped a few people. The studies showing hydroxychloroquine not working often didn't use zinc, and that's regrettable. But we still don't know much about the real benefits of hydroxychloroquine. So at this point, we don't even discuss it on our website. If we do, it's just a very much of a footnote. There are better medications out there than hydroxychloroquine that are at least validated better as of today's date. And we again recommend that inflammatory markers be tested in the hospital. They have the ability to do that. And then also thrombotic risk factors, coagulation markers like D-dimer. You want to make sure that these COVID-19 patients are not enduring abnormal thrombotic events. That's blood clotting inside their arterial system and their venous system for that matter. These people are having so many abnormal blood clots, both major and minor. They're throwing strokes, they're having heart attacks, they're having parts of their body be deprived of blood. And that can be easily prevented. for almost every COVID-19 disease patient to ask their doctor, please measure my D-dimer and other coagulation measures. And if they're elevated, prescribe the low molecular weight heparin. That's a standard drug available in all hospitals. And not only does it reduce the coagulation risk, but it also has anti-inflammatory properties on its own. And another benefit that it may induce is that it inhibits that spike protein that comes out of the SARS-CoV-2 virus. By inhibiting the ability of that spike protein to bind to cells, it may have an antiviral benefit in addition to its anti-inflammatory property, and of course, its standard approved use, which is to prevent abnormal coagulation. So we're recommending that anyone going to the hospital with COVID-19 disease, please ask for inflammatory marker testing, which includes C-reactive protein and interleukin-1/6, and also make sure that the appropriate drugs are prescribed when those markers are elevated. It could spare a lot of COVID patients from progressing to needing the ventilator. It could save a lot of the lives.
I'm sure many of our viewers would like to know where they can find this information to put on a page to bring to the hospital if they ever need to go there, and to ask the doctors for these treatments.
Well, our group is developing protocols to consider, and one of them might be interferon alpha. Now, that's a drug that they used to use to treat hepatitis, and they got about 50% success rates with it. When they added another drug to it called ribavirin, they improved that sometimes up to 90%. Remarkable benefits when they combined interferon alpha and the combination of the antiviral drug. So what we're suggesting for people who are hospitalized is to ask their doctor to consider interferon alpha initially, because it has potent antiviral properties. But it has to be administered very carefully because you don't want to overstimulate the immune system. But the good news is they can test to see if they're overactivating immune functions, so they can judiciously use the interferon alpha in a way that can improve the immune status of a hospitalized COVID-19 disease patient, hopefully clear the virus faster, and if the inflammatory factors elevate, they can bring those down with another drug called Actemra, along with the low molecular weight heparin, which also has the anti-inflammatory benefits. Some doctors are advocating low molecular weight heparin plus aspirin plus Actemra if warranted, and then possibly initiate, though, with the interferon alpha to more rapidly clear the virus. These are all FDA-approved drugs, and what we're suggesting is that a patient going into the hospital simply ask their doctor, do you have any experience with these drugs? Can you consider prescribing them to me appropriately? And maybe they'll produce a more favorable outcome.
Again, I'd like to ask, where can our viewers obtain a sheet of paper that clearly illustrates what you've just described?
Well, the website that we set up, this is an independent website. It's only for people who are progressing with COVID-19 disease to the point of needing hospitalization. We'll expand it later on, but at the moment, we're trying to save the lives of people acutely. And there's people in hospitals right now, they're getting worse, and some of their doctors are not informed about these repurposing of these drugs. They're already in the hospital formulary. The doctors are allowed to prescribe them off-label, but some of these ICU physicians, they're just too busy treating patients. They don't have all the time in the world to look at some of the chat rooms that doctors have actually set up where ER and ICU physicians are communicating with each other, and they're describing clinical improvements in response to using these types of medications. So the website that we established, free access to everybody, we simply open source the information. We report on what frontline physicians are talking about that are achieving some clinical benefits on a premature basis. I say that prematurely, these are all experimental therapies. But if you're progressing with COVID-19 and you want to avoid the horrors of a ventilator, you may want to experiment with these drugs with your physician, of course, prescribing them in the hospital to you.
Fascinating. Bill, Tony and others are saying that everyone should wear masks.
Well, it's almost common sense that when you have a respiratory virus that's being spread primarily via airborne transmission, you of course want to reduce the volume of airborne emissions that you are potentially infecting somebody with. So any type of physical barrier is better than no physical barrier. If you're lucky enough to have the N95 masks and you wear them really tight, well, you're going to reduce your risk of inhaling that virus dramatically. But I watched a video from a prestigious Korean doctor, and he made it so clear over a 28-minute period that putting any kind of covering over your mouth and demanding other people do it around you, you're going to have some reduction. And if you have access to a really good N95 masks, you're going to significantly reduce your risk of transmitting the virus to someone else or you obtaining it from somebody else. It truly is common sense. It took 28 minutes for this doctor to explain that in Korea, but it made a whole lot of sense to me. So of course we advocate people wear masks and use whatever you have, but ideally an N95 one if you get your hands on it. And of course, isolate wherever you can.
And Pat actually is very interested in wearing not only the N95, but one of the sono masks over it.
Yeah, there are better ways to reduce your risk of inhaling that virus. And I know an Israeli firm has developed something that you can actually wash repeatedly. It still works after washing, and put it over whatever mask you have, and it dramatically improves the filtration, prevents that virus from getting into your respiratory tract. Very, very important for people to consider that. And it's brand new. I hope it becomes available very, very soon, because most people don't have N95 masks. This essentially transforms whatever mask you're wearing into an improved device to prevent infection.
Yes, it incorporates nanotechnology, I understand. And I'd like to ask you, what does the future hold? How long is this going to last, do you feel? And
how long is COVID-19 disease going to be around? Nobody knows the answer to that question. It could become a chronic problem. That's our biggest concern, that it never really goes away, that we have outbreaks of it just like we do influenza and the common cold. What I'd like to think, though, is technology will evolve. And the latest report that I read, and it's on our website, it's about antibody cocktails. In other words, there may not be a single antibody that will totally prevent one from contracting COVID-19 disease or even being reinfected with disease they may harbor. But they're looking at 2 or 3 independent antibodies that if you put them all in at the same time with a vaccine, you could completely immunize people against reinfection or infecting somebody else. And as it relates to antibodies, please remember, most viruses will produce an antibody. HIV, hepatitis, herpes, shingles. I mean, they produce antibodies, and it doesn't necessarily confer long-term protection, though some of the newer shingles vaccines will do that. But for other diseases, if you have a positive HIV antibody, it doesn't make you feel good. It means you've been infected with HIV and you're probably permanently infected. In other words, the antibody does not kill the virus. It simply manifests in an attempt to kill the virus. That's what a lot of people don't quite understand. So if you do understand the concept of antibody science, that is, we need a very effective antibody against the COVID-19 disease because it's out there. It's so transmissible, we just can't assume it's going to disappear anytime soon.
Now, life extension has been in the forefront of research in anti-aging and the diseases of aging in general and so forth, and pioneered in so many areas. What would you suggest people do to try to minimize their risk or strengthen themselves?
Well, what we do know is younger people often contract the virus. Many of them don't even know it. Some of them are just sick for a little bit and then they get better. Whereas older people, they don't fare as well. Their immune systems are more pro-inflammatory, number one, and they're also deficient in natural killer cell activity, numbers of naive T cells that are required to attack that virus and destroy it. So what we know is young people, the COVID-19 disease, not usually a big problem. The older people get, the worse it gets. And for some of those middle-aged people, a lot of them have very defective immune systems and don't even know it. We do all types of immune risk testing at Life Extension and through various physicians we collaborate with. And we sometimes see a 40-year-old. They have the immune function of an 80-year-old. And sometimes it's vice versa. We'll find a really healthy 80-year-old and they've got a really good immune system. So no one really knows how effective their immune system is until they get some rather elaborate testing. We're happy to refer people out to doctors who do that. But what's important is that if you have a defective immune system, be exceptionally careful. And if you're over a certain age, normally your immune system is not where it was when you were younger.
To conclude, Bill, what final message would you share with our audience at this time?
Well, the audience should know that our life extension group introduced a drug. When I say introduced it, it wasn't ours, but we knew it existed. The drug was called ribavirin. We recommended that in the early 1980s to our life extension readers as a broad spectrum antiviral that could help reduce the severity of common viral infections and was particularly effective against hepatitis C. We fought a multi-decade battle to get the FDA to approve ribavirin as a treatment for hepatitis C in conjunction with the interferon alpha drug. And we showed one study after another to the government and to the media that when you combine these two drugs, interferon alpha and ribavirin, you get a substantially improved clinical response. Many more people were cured or put into a state of complete response when the two drugs are put together. And what that tells us is when it comes to treating this new coronavirus, it may not be one drug. We may need several different interventions to completely remove it from our everyday concern. It may not be something singular. It may be a multi-therapy, and that's okay. We at Life Extension are used to putting together cocktails of different medications, nutrients, hormones. And when you put them together in the right way, you often get a more favorable outcome. So I advise your listeners to be more open-minded about what they look into. They want to maintain their nutritional status, their hormonal status. They want to do everything they can to maintain healthy immune function. Just little tidbits like certainly vitamin D, D as in David. You want to maintain a healthy level. You don't want to be deficient or insufficient in vitamin D during a period of time like this, but taking in a lot of garlic supplements. Certainly want to make sure your vitamin C intake is proper. There are other nutrients that are absolutely proven to maintain immune function. Even the National Institutes of Health talks about the fact that vitamin D is required for healthy immunity. It's an absolute scientific fact, along with zinc and other nutrients. If you're deficient, your immune function will not be as healthy. And these are low-cost supplements available everywhere. So people should certainly make sure they're not deficient in something that they can easily take.
Bill, thank you so very much for this essential information. Let's do this again regularly as things get updated.
I look forward to it, Richard. And again, people can log on to the website and just keep that website in their computer or whatever, because it's not for people, it's not for everyday reading. It's for people who are facing hospitalization because of worsening COVID-19 disease, and it gives them at least a blueprint of information as to what they can ask their hospital ICU doctor for that may reduce the worsening of their COVID disease. We don't want people going on mechanical ventilators. We talk on the website about some alternatives to ventilators, by the way, in the hospital. And as an educated patient, you can inform your doctor as to what you might want, as opposed to what he does for the typical person that walks in the door.
And this information, of course, is on the new website, which we have on the screen, but also a lot of very important information at lifeextension.com.
Yeah, Life Extension has different information. The website that's on the screen, that's specifically for people who are progressing with worsening COVID-19 disease. And the reason I keep mentioning the importance of that is that people, when they go into that hospital, they pretty much lose a lot of control. But if they can come in with some good, solid information, and it's all still experimental, but they can at least ask their doctor, would you mind measuring my interleukin-6 blood level? If it gets over 80, can you please prescribe the IL-6 lowering drug? It's real simple. It's just a matter of knowing this information so you can ask your doctor. And for any COVID patient going to the hospital, they probably should be on low molecular weight heparin unless it's otherwise contraindicated. But a D-dimer test and some other coagulation markers can let the doctor know if this is an appropriate drug to prescribe. So there's a lot of good biological markers available in the blood that can dictate what type of therapies are used, and that's what we put on this brand new website.
Bill, this has been so very important. On behalf of our audience, thank you so very much.
You're very welcome, Richard.